Hello everyone. Today, we're delving into the world of a life-saving medication called naloxone, commonly known by its brand names Narcan and Evzio, and its generic name Naloxone. As with all our discussions, this is meant for educational purposes. If you have health-related questions or concerns, always reach out to a medical professional. Description: Naloxone, known by its brand names Narcan and Evzio, and its generic name Naloxone, is a medication used to rapidly reverse opioid overdose. It belongs to the class of drugs known as opioid antagonists. Naloxone works by binding to opioid receptors in the brain, effectively blocking the effects of opioids and reversing the respiratory depression that often leads to overdose deaths. Approved by the FDA, naloxone is available in various formulations, including nasal spray, injectable solution, and auto-injector devices. Its administration can quickly restore normal breathing in individuals experiencing opioid overdose, potentially saving lives in emergency situations. Warnings: While naloxone is a crucial intervention in opioid overdose emergencies, it's important to note that it may precipitate withdrawal symptoms in individuals who are physically dependent on opioids. Therefore, medical supervision and follow-up care are essential after administering naloxone. Additionally, naloxone is not a substitute for emergency medical care, and individuals who have received naloxone should seek further medical attention promptly. Before administering naloxone, it's crucial to familiarize yourself with its proper use and administration techniques. It's essential to have naloxone readily available in environments where opioid overdose is a risk, such as households with opioid users or community settings. Training in recognizing the signs of opioid overdose and administering naloxone can save lives in critical situations. Additionally, it's important to follow local regulations regarding the possession and administration of naloxone. Side effects: Naloxone is generally well tolerated, but like all medications, it can cause side effects in some individuals. Common side effects of naloxone may include withdrawal symptoms such as nausea, vomiting, rapid heart rate, sweating, and agitation. These symptoms typically occur in individuals who are physically dependent on opioids. However, the benefits of naloxone in reversing opioid overdose far outweigh the risk of side effects. Interactions: Naloxone may interact with certain medications, particularly opioid agonists. It's essential to inform healthcare providers of all medications, supplements, and herbal products being taken to avoid potential interactions. Dosage: The appropriate dosage of naloxone depends on the formulation and route of administration. Nasal spray and injectable solution dosages vary, and instructions for use should be carefully followed. It's crucial to administer naloxone promptly in suspected opioid overdose emergencies and to seek medical assistance immediately. Avoid: While administering naloxone, it's important to prioritize the safety of both the individual experiencing opioid overdose and the responder. Follow proper infection control procedures, including hand hygiene and the use of protective equipment when administering naloxone. FAQ: Many individuals wonder about the availability of naloxone and whether training is required to administer it. Naloxone is available in many pharmacies without a prescription in some regions, and training programs on its administration are often provided to community members, first responders, and healthcare professionals. Check local regulations and resources for more information on accessing naloxone and training opportunities. Closing: That concludes our overview of naloxone. Remember, this information aims to educate and should not replace professional medical advice. Always seek emergency medical assistance in suspected opioid overdose situations and consult with healthcare providers for any questions or concerns. Thank you for tuning in.